Good afternoon, good evening here in Geneva. Thank you very much for joining us here. And for those of you who are online, thank you very much for joining this session. I would like to, first of all, say that there are two of us who are going to moderate. We have done so many different things in the past, but this is the first time there are two of us across two different continents who are going to try and moderate a virtual session which has people from at least 4 different continents today. So it's an experiment. I'm sure some of you have seen this before. We'll try our best to keep the session going smoothly. Without much ado, I'm going to hand over to Roland Gode, who is the chair of the board of the German Health Alliance and also a member of the Health Innovation Exchange Advisory Group. Roland was to drive to Geneva, but is now in Germany. He's going to welcome us from Germany. Over to you, Roland.
Yeah, thank you so much, Pradeep. And indeed, it would be an honor and privilege to be in Geneva. Honorable Ministers, Excellencies, esteemed speakers and discussants, dear colleagues, dear ladies and gentlemen, it's truly my honor and privilege to cordially welcome you to this 2021 UNAIDS Health Innovation Exchange event on new horizons for investments in innovations for global health and resilient health systems, co-organized with Cross-Border Impact Ventures and the Geneva Innovation Movement. And it's a pleasure to do so on behalf of the Health Innovation Exchange and as chair of the GHA German Health Alliance. I have followed Health Innovation Exchange since its inception, recognizing its unique role in bringing together policy leaders, investors, and innovators. The coronavirus pandemic has been showing us on a global scale how closely health is linked to almost all aspects of our lives. First, in its most obvious meaning as health for every individual. Secondly, as an important goal and global public good of health for all, leaving no one behind. And thirdly, in the realization of how much health and health systems interact directly with society, politics, economy, climate and nutrition and other areas. The latter should not come as a surprise to us or seem like a new insight, because it is precisely this reciprocal causality that is so clearly reflected in the 17 Sustainable Development Goals. Recent epidemics, including Ebola and now COVID-19, have underscored the fragility of health systems around the world and highlighted the critical importance of building resilience. It has also demonstrated the potential of innovations. We really need to invest in innovations to rapidly scale up access to healthcare. We need to develop new financing models that leverage public and private investments for impact. And this calls for innovative public-private partnerships. The Health Innovation Exchange plays a major, crucial role in this respect as it stimulates SDG-inspired partnerships, building a new, innovative and much-needed bridge between innovators, investors and implementers. In light of the SDGs being dramatically affected and hampered by the current pandemic, considering health systems partially failing both in the global north and the global south, there is highest priority and utmost urgency to further build and strengthen this bridge. We cannot afford any delays that immediately cause suffering and lead to further loss of life. COVID-19 is more than a health threat. COVID-19 is a complete system threat. As our coming pandemics and health crisis, we thus need to consequently work in terms of truly systemic strategies towards health, breaking silos and any borders in mind and action between actors, sectors, disciplines, cultures, countries and regions. Scaling up access to health is a global investment, granting the maximum possible return on investment. Undoubtedly, today's event will directly contribute toward this crucial goal. And in addition to the extremely important discussion and the presentation of new innovative models and platforms, it's really wonderful that 2 concrete, tangible new partnerships will be publicly announced as well today. Please allow me to express high appreciation and cordial gratitude towards all speakers and everyone having contributed to making this event possible. Now, I wish all of us a most interesting and insightful, inspiring exchange and discussion. Thank you so much for your very kind attention.
Thank you very much, Roland. I'm quickly going to introduce my co-facilitator for this evening, Joanne Manreike, who is the president of the Center for Global Health and Diplomacy. She's going to moderate from Toronto today. She's usually based in Washington. She was going to be on a plane to Geneva, unfortunately, because of the travel restrictions. She's not been able to travel. I also want to welcome Dr. Lia Tades, the Minister of Health of Ethiopia, and Dr. Austin Demby, the Minister of Health of Sierra Leone, who have joined us. Dr. Lia, it's such a pleasure to see you. Congratulations for all the work that you're doing in Ethiopia. We wanted to start with you, Minister. You have had a very, very successful approach to building resilient health systems. You've invested in capacities, you've invested in innovation. Would love to hear from you, what are the innovations that you're drawing on? What are the challenges that you're seeing? And again, what are your messages to the investors who are in the room? What would you like them to do to align with your vision and innovation? Look forward to hearing from you, Dr. Lia.
Thank you very much, Pradeep, and greetings, everyone. It's a pleasure to be in this panel addressing this critical topic. Indeed, building resilient systems needs investment as well as innovative way of doing things. And the COVID pandemic, I believe, has taught us a lot of learnings in terms of how to address, how to use innovation to really build our systems. And I just want to highlight especially the few learnings from the response in the pandemic as we move towards building a resilient system. One critical issue is a strong coordination, coordinated response, which is one of the key foundations for how the results we achieve are in this kind of pandemic. And some of the coordinations and also other pillars that I would raise are actually what we had been building during the earlier times of preparing for the Ebola pandemic, like establishing national public health institutes with emergency operating centers that can be activated as we have these kinds of challenges. And this was one of the things we immediately did, but that was not the only aspect, but it needed a national coordination as a Minister of Health leading the response with the different sectors. Thus, having a COVID national task force was key in terms of how we were responding to the pandemic, with a technical arm being by the National Emergency Operating Center, but all the way to the subnational level with similar structures down to the regions, and having rapid response teams who are also responding in the districts and villages. We also used our existing community health extension workers to actually go house to house to help the surveillance system. And in addition, key in such systems is the surveillance system, which starts, of course, from port of entry, screenings and mechanisms we put in place that were also somehow initiated during the preparedness for Ebola, but we continue to build upon these activities while we were dealing with the pandemic. Human resource, of course, is a critical aspect. Health workers, having the right health workers in place, and for example, field epidemiology training was one of the new training programs that was in place during the preparedness some years back, which has become instrumental in our rapid response teams as we embarked in the response to the COVID pandemic. And as you can see, it shows that the primary healthcare system becomes a foundation for a strong response. The other key issue is, of course, how do we utilize the existing systems to cater for the pandemic while we maintain essential services? So while we used existing facilities, to some of them, to dedicate them for COVID service, we were also, we had to innovate and use places like meeting halls, youth centers to makeshift hospitals. And that was really critical in the response. But at the same time, we didn't want to invest too much in those makeshift ones, because we want to make sure that the investments we are putting on in critical care, oxygen capacity and others will sustain the system going forward. So more of the investment to go to the existing health facilities, but in a way that can easily be shifted in the makeshift hospitals as well. And I think the other critical issue is really, as we think of health workforce, we needed to have trainings in a short time. So we were using virtual trainings for our health workers to have some of the confidence to go and start the services. And because of the shortage we had, for example, in critical care nursing, we had to do short trainings, particularly using technology to help advance and deploy those workers. And maybe if I have time, I would like to add a couple of points. The other key issue was, as you know, disruption of supplies was a key challenge in this pandemic, with a lot of lockdown in many of our suppliers. So we had to use the opportunity to work closely with the private sector and other sectors like trade, industry, ministries to push to use the existing facilities to divert to other kind of manufacturing like PPEs and sanitizers and others, which we have seen great progress within this time. So really working with the private sector very closely, and not only in manufacturing, but of course to share services like the lab testing and even case management. So really a stronger public-private sector engagement was particularly key. And finally, I cannot say without talking about technology when we are saying on innovations and the use of course, we try to use existing platforms like the district health information system to develop COVID trackers for collecting particularly lab results daily from all regions. And also later we try to extend it to give text message to those who are being tested as well. And we also now are integrating it for the COVID vaccine rollout, so that we're tracking the vaccination as well. So the digital and technology was also a critical aspect in terms of the response. So, I mean, it's a combination of many things, but the challenge that also became opportunities, I believe, that we need to continue learning from in the way forward for our resilient system. Thank you so much.
Thank you so much, Minister. I'm sorry, I was having technical difficulties and was on mute. It's a pleasure to be here, and thanks again to the Health Innovation Exchange. It's been an honor for the Center to work with the Health Innovation Exchange since 2019 in a lot of strategic partnerships. So we're looking forward to next steps. I'd like to welcome Dr. Dembe, who has been a champion of the AIDS movement, having played a key role in helping to combat HIV in Africa, and was also one of the key voices in Sierra Leone's Ebola response. Honorable Minister, you've demonstrated in both cases that pandemics can be reversed and overcome. What are the challenges that you face in your role as Minister of Health in scaling access to healthcare, and where can innovations make a difference? What investments from the private sector and impact investors, which are here with us today, would be a priority given Sierra Leone's context?
Well, thank you very much, John. This has been a really great opportunity. It's nice to see my colleague from Ethiopia as well. As you rightly said, I was very active in the HIV space and was very active in the Ebola response here in Sierra Leone. I think there was a lot of innovation. Initially, we started out with a lot of fear and not really ready for the outbreak in 2014. But by the end of the exercise, after a lot of lost lives from both healthcare workers and the general population, we're still reeling from that. We're still recovering from that. But there was a lot of investment in that response that was particularly helpful when we confronted COVID-19. Just as my colleague from Ethiopia indicated, we had the experience of setting up an incident command structure in Sierra Leone. We had all of the major pillars that were very active in the Ebola response, and we're able to quickly activate those for Corona. And in the middle of Corona, we also had a big outbreak of Ebola in neighboring Guinea. And what that meant was, even as we focused on the COVID response, we also, just learning from the history of what happened here in the region, were able to devote a lot of time and attention to what was going on in Guinea, with a clear strategy of first working with the Guineans to contain the outbreak in Guinea, but at the same time working on our borders to make sure there's active surveillance to prevent the introduction of the virus in our country. And at the same time to make sure that if it were ever introduced, that we're able to contain it. So between COVID-19 and Ebola, we also had a polio situation where we were vaccinating for polio. At the same time, we're also vaccinating for Ebola at the same time. So there was a lot of activities going on the same health workforce, attacking multiple scenarios, multiple outbreaks at the same time, or potential outbreaks at the same time, and putting undue pressure on the teams. We were able to crush the first wave, the second wave, and now I think we've successfully crushed the third wave, but we're also preparing for the fourth wave. One of the new things that happened this time around that we didn't have before was some of the platforms that are available now. By using a simple Zoom platform, we're able to reach out to all of the district health management teams in real time. About an hour after the announcement in Guinea, we're able to find out what their state of readiness was and what were their challenges and opportunities. We're able to restock and resupply. We're able to deploy rapid response teams to all of them in the front lines. And in very, very rapid succession, we were able to make sure that we had real readiness in case you had a case of Ebola reintroduced in Sierra Leone. I think there were lots of technological innovations that we found extremely helpful. Prior to all of this, we were looking at Excel spreadsheets and looking at two-dimensional paper maps to see what was going on in our country, and it was extremely difficult. With some of the innovations and with GIS tracking and GIS mapping, we're able to better understand cases and case clusters. We're able to track the responses that were going on in the different areas. We're able to deploy resources appropriately to all of these different sites for all of the different outbreaks. I think for me, one of the biggest missing pieces in all of this for Sierra Leone is an ability to have an institutional home that harnesses all of the technology, all the research capability, all of the vaccine work into one institutional home, which is missing. And so what we saw in the coronavirus response is that a lot of the gains that were attained in 2014 and 2015, when it came to engagement in 2021, it was more a relic of what we had at the tail end of our response to Ebola. We wish we'd had a real structure that we're able to harness the FATP innovations that are there, the surveillance and epidemiology innovations, the care and treatment innovations, the vaccine innovations, the supply chain and tracking innovations that were utilized in the past. I think these are all opportunities for applying those in the current state to create a real stable system within the country that's able to prepare, that's able to have early warning trigger systems, that's able to respond appropriately. So I think we've learned a lot, but I think in the absence of an institutional home, we'll struggle for the next wave of infections that may come in. I'll stop at that. Over.
Thank you, Minister Demby. I've followed your work on HIV for several years now, and I've been very impressed. I've seen what you've done. And it's also fantastic to see that you're also looking at lots of innovation in terms of staffing and reforms within the health ministry. So would love to try and see how we can support you with that work. One thing which you mentioned, which is music to my ears, is the need for housing all these different innovations in a place where people can see it, engage with it, and learn about it. We have been speaking about setting up a health innovation discovery center. We are planning one in Geneva, which will be launched sometime in 2022. But we are also discussing about potentially having one based out of Africa and one based out of Asia, potentially in India. So that's something which we would love to also get your advice on. Let me move to one of the innovators, one of the leaders when it comes to looking at technology. I'm moving to David Wallistein, who is the Chief Exploratory Officer of Tencent. David, both Minister Leah as well as Minister Demby spoke about how technology can be harnessed, and they are already harnessing technologies for the COVID response, but also for broader resilience of health systems. As someone who looks at innovations and technologies that are emerging, someone who's at the cutting edge, not necessarily just for health, but across the whole spectrum, I would love to hear from you. What we see is that there are some innovations which can be transformative, but there's also a lot of noise. So my first question to you is, what is the one message that you would have, one advice that you would have on what is in the pipeline and how do we get the best for the best impact? And the second question, I know that because you also have been transformative when it comes to financing innovations and looking at financial models. For me, the big challenge that I see is that Africa gets less than 0.01% of the entire private capital that goes into innovations. How can we transform that? What are the lessons that you've learned from your past working with China? So, David, really good to see you. Thank you for joining us. And I love your background.
Thank you very much. Thank you very much for having me, Pradeep, Your Excellencies, and all the guests here. Sorry I couldn't make it to Geneva today. So I've been working on technology for about 25 years now. Tencent at one point was a 45-person company. Now we're 100,000, and we're very actively investing around the world. So I've seen a lot of seeds of an idea grow into very big and consequential companies and technologies. One thing you learn over that period of time, 25 years, is that what's more important than actually thinking about the technologies, it's really focusing on the problems that you're trying to solve and being very, very specifically focused on those, because there are so many technologies at all times. And I've really grown over the years to see technologies as a building block, almost like they're hammers or nails or screws or screwdrivers, wonderful tools to work with CRISPR and genetics and all these things that are happening. But at the end of the day, the most important thing really is to be crystal clear on what you're trying to solve. And I struggle as someone who is often in Silicon Valley, often in China, and often in Europe, and not often in other parts of the world, especially for the past 2 years. I struggle to know what those critical challenges are from afar. We work with so many entrepreneurs with brilliant ideas, but the challenge in marrying what they're working on with what the biggest needs on the planet are is that we don't have enough information. And I've really grown compelled over the years to encourage decision makers and leaders to be very specific and very clear on what the challenges are that you're trying to target. Then, if you could, inundate the market with information, background information. Let's talk about Ebola. I think Ebola was mentioned earlier. What are the conditions that lead to the Ebola spread? And what are the, who tends to suffer more than others? Getting all the nitty-gritty details around that, because it may be in those very specific details that an innovator, a scientist, someone around the world says, aha, yeah, I didn't know anything about this country. I didn't know anything about this disease. But when you talk about these things, I've got an idea. Let's think a little bit about water treatment. Let's think about something else. It may come from left field. The innovation that could be a game changer may not be the vaccine that we were expecting. It might be something as benign as a mask that we've all grown very accustomed to wearing over the past 2 years. We don't really know. And again, a mask is a good example of not really the most cutting edge innovation, but something highly effective we've all learned with COVID. These are just tools again. I feel what's really missing is we need a channel where decision makers and ministries are continuously putting out very detailed information about the state of their highest priorities, and then matching that. This is where it gets even more tricky, because sharing information sometimes isn't as easy as it sounds. But once you have that, then actually making it easy to be contacted by the outside world in a way that scales with your organization. It may be just having an email address. It may be tasking a team, 1 person, 3 people, 5 people, 10 people, to proactively engage with the outside world to discuss innovations. And they may be going to a professor somewhere. They may be working with local experts. But I think without having the mechanisms in place to embrace innovation in an organization, so I'm talking about people and processes, and also a very clear prioritization. it's going to be very challenging to take advantage of something like mRNA vaccines. But once we have a target like COVID, we can say, great, let's target this mRNA vaccine at this target called COVID. It's not going to obviously work for everything, but it's about matching that tool with the affliction. So again, what the market needs to tell us, and the decision makers, the owners need to tell us, is what are the most pressing issues. I think I've made that clear. Pradeep, can I answer the second question now, or did I talk too much?
No, absolutely. That's a multi-million, billion-dollar question. So absolutely,
Okay.
would love to have your answer.
Yeah, it sounds very simple what I just said, but believe me, it's very hard to get done at scale in practice. So I think we start with this, and then we move to more sophistication from there. Okay, regarding investment and how do we really bridge kind of the magic of what we see happening in certain parts of the world with Silicon Valley. I think this is there are positive trends. We've invested in a number of companies in Africa, actually raising record sums of money. It's a very interesting time. But I think at the end of the day, investors are very funny animals. They like to have everything done the same around the world and treat the world as if it's just one big playing field. So to the greater extent that all of the processes for, first of all, becoming an investor in a company can be made easy. Can you, for example, can you fill out all the documents to be an investor by DocuSign? Do you have a reasonable rule of law? Do the documents seem the same as in foreign countries like the United States? It's kind of very basic stuff, but to the greatest extent that your economy and the practices of funding innovation, as in the private sector, to emulate what you find in the United States and other markets, Europe often, but not always. Europe can be challenging too. That I think is going to be hugely beneficial. And then I think really what's necessary is one or two success stories. So to the extent that the local government can rally around a few local champions that seem to be attracting interest and support those companies to have success, I think investors are quite prone to really supporting one or two famous companies who break out and show there's an example that you can come in, you can invest, you can have a nice return, and everything goes well. I think the flywheel just naturally gets going. And what I think you've probably heard a lot of this before, but what I want to emphasize is now is the absolute critical time to embrace this, because if you're not aware, it's really something that showed up on my radar with our early stage portfolio companies we've been supporting, particularly those in Africa. It's been very hard for these companies to raise money in the past, but in the past year or so, they've really started to take off and attract very large sums of money. So now is a fantastic time to learn more about those case studies. Why are the international investors coming in? What can we do in our local environment to make it attractive to investors? I think it's kind of a very exciting moment right now. So I encourage you to look into what's happening in certain countries. Nigeria is having a lot of activity, for example, and seeing how can you emulate that success, but we have to keep it going. We have to make sure investors are having good experiences. So we can encourage many more. And it could be like a China kind of situation. 1999, China had almost no venture capital investment. Now it really does rival the US at scale for these investments. I see this happening globally, and now is a perfect time to embrace this trend.
Thank you so much, David. And I think a lot of what you're saying in terms of the investment, it is some investors do expect kind of that cookie cutter, solution, and it's not a cookie cutter solution. That I think that's where the Health Innovation Exchange gives it that personalized local area and knowledge of investment. And so with that, I'd like to ask Annie, who's Chief Investment Officer of Grand Challenges Canada, a question regarding a lot of the innovations that they see that are coming to fund, and that could be transformative if scaled, yet many innovators struggle to reach both scale and impact. Annie, what are some of the barriers and challenges that you see, and what's one of the messages that you would give the ministers who are currently in this session?
Oh, hello. Okay, perfect. Just to clarify, my purview of the Grand Challenges Canada portfolio is quite specific. I look at more of our commercial or quasi-commercial ventures, and I've spent the last 3 years really looking to raise a fund in health technology. So just qualifying that in terms of the comments that I will make, it may not apply to all of our innovations, which are very, very different. We've funded over 1,300 different ones over the last 10 years. So just to give you a bit of background. In terms of some of the common challenges that we see, there's really a number of them. First of all is, I come at the world from the perspective of an economist, so I always look at the financial side first. But often what we see is that these companies may struggle to raise capital, particularly when they're moving from proof of concepts into what we call the transition to scale at GCC and into different phases of scale, because they never quite have all the proof that's required for the next stage, and they have to expand their network of funders that they're speaking with. If they're trying to reach underserved populations, obviously the margins are lower, and so they need to bring in some grant capital or more friendly forms of capital so that their commercial investors continue to be supportive of those activities. There needs to be a little benefit left commercially, even though the activity is meant to reach underserved populations. And so I'd say that whole bucket of financing is a challenge. The other piece that is sometimes a little scary for companies is when they go into a new market, who's going to pay for the product? Is it a government? Is it a private sector a payer? Is it an insurance scheme? Is it out of pocket? So how can we make that a little bit easier, and how can we make entering an economy friendly to all of these potential payers? And that's, I don't think it's a nut that's been cracked, but I think if we're going to see a day where there's equal access to all of the world-class technologies in health that are available out there between the global south and the global north, we'll have to figure out that who pays question very easily, smoothly, and whether you enter through government or you enter through a private sector or the pay out of pocket, that whole framework has to become a little easier. And finally, I think it's just how can we create these connections? And that's where working with Pradeep and the team has been really quite wonderful. They have a very broad network. So when we look to different technologies, we call our friends and we say, okay, we need to meet new friends in other places. So how can we link private sector innovators together with governments and otherwise? So I'll just pause there, but those are some of the issues that we see.
Thank you very much. Maybe I'm going to do a little bit of change of the session. I'm just going to turn to the ministers, Minister Leah and Minister Demby. If you have any questions of Annie or David or the other innovators in the room, if there's anything that you would like to raise at this point, do feel free to jump in. While you're thinking about that, I'm also going to, Minister Demby, did you want to come in?
Yes, I think this is really quite impressive, the breadth of knowledge and approaches that's been taken to harness innovation. I think for me in Sierra Leone, I have a vexing problem that I'm trying to solve. Sierra Leone has one of the highest maternal mortalities in the world. And we're actively looking at drastically reducing maternal mortality.
Minister Demby, we can't hear you. There seems to be a problem with the connection. Okay, so while we reconnect with Minister Demby, maybe, and I think you've raised a very important question, but we'll come back to that. We have both from the investor and innovation side. Let us listen from Girish Ramachandran, who is the president of Tata Consultancy Services, who is joining us virtually. So Mahesh, if you could help.
Well, I always say that while there used to be technology in everything we do, what probably COVID has taught us is that every business is a technology business. At the macro level, this requires governments to build a digital foundation to level the playing field by ensuring uniform access to technologies. And governments play a key role in instigating system-wide digital health projects. And there is a clear mandate that governments need to start building a digital spine, leveraging internet, cloud, mobile technologies, big data, AI, and other innovations for connectivity and collaboration, backed, of course, by strong cybersecurity. By further sharing IT infrastructure with other public services, such as Citizen ID and Consent Management System, the government drives this digital spine to accelerate healthcare industry's transformation to basically data-driven organizations. This digital spine also creates a connected ecosystem where public and private enterprises can proactively share information and cooperate, especially with the adoption of innovation accelerators like 3D printing, IoT, blockchain, and augmented and virtual reality technologies. Private sector also needs to play its part, and it also needs to build a digital spine based on 4 C's. First is ensuring connectivity by creating reliable networks for many life-saving medical systems housed inside hospitals, and to deliver healthcare remotely outside them. Second is collaboration and communication mechanisms so that co-working across healthcare system is possible. Third is digital access on the cloud, making digital data record sharing easier and safer to access when required, automating backend operations and facilitating and creating the maintenance of telehealth system. And the fourth most important thing is cybersecurity to protect sensitive personal information of patients. Citizen privacy and trust is crucial for shaping economic and community attitudes to deal with new threats posed by health crisis. To this effect, I'm very happy that TCS and HIX are working on the concept of spine, which is specialized and proficient integrated network of experts. The proposed model focused on accessible healthcare delivery and innovation through the spine network, comprising of a health grid, an ecosystem of partners and startups, a network of qualified experts and research and innovation systems to solve problems of healthcare. It also brings together research and innovation. The key elements of spine include a health grid that leverages technology, people, and processes to improve affordable and timely healthcare by digitally connecting with primary, secondary, and tertiary healthcare providers, a real ecosystem of partners, including HIX innovation system and startups from the TCS co-innovation network. I am very happy that we are able to build this platform together and able to create impact for overall healthcare transformation. Thank you very much.
Thanks, Girish. While we wait for the others to connect, I'm going to probably move on to the next part of the conversation, and we'll come back in a minute. I would love to hear what Dr. Demby had to say, particularly about maternal health, and also this on vaccines. Also, there are some solutions in the room here. Let me now move to Dr. Peter Singer, who is a special advisor to the WHO Director General. Peter, you've been an inspiring voice on innovation. You were the CEO of Grand Challenges Canada, and you brought the same spirit of bringing together innovators, ministries of health, the WHO system, and the UN system broadly to focus on bringing innovators and innovations for scaling access to healthcare. Thank you very much for what you're doing and for the space that you're connecting so many different voices. Peter, from your perspective, what is the role of the SDG Accelerator? Where do you see the value of innovators, countries, and investors working together? And from your own experience as someone who's been a pioneer in the innovation space, would love to see where next, what do we need to do next to get innovations to scale? Thank you, Peter.
Thank you, Pradeep. That's very kind. Let me start by expressing respect and appreciation to Ministers Tedeschi and Demby for joining us today, and of course to all the colleagues and partners. And I also want to start, Pradeep, just by recognizing your crucial role. You've been a real pioneer in the area of innovation. And I think everybody on this call owes you a debt of gratitude for your leadership. With respect to the SDGs, this really is about problem solving, as I think David just said. And the first thing to say is the world is way behind on the SDGs. So, for example, on the universal health coverage one, WHO estimates that about 1 billion people would be needed to go on to universal health coverage to reach the SDG between 2018 and 2023. The shortfall in that number, not the attainment, the shortfall was about 730 million people out of the billion before COVID and more than 800 million after COVID. So that's the burning platform. And the key point here is that innovation can accelerate SDG progress. And that's what it's about. It's about solving that problem, which is so deeply held by countries. Secondly, the barrier to solving that problem is scaling innovation. As Annie mentioned, at Grand Challenges Canada, which I had the privilege of working at before, as you mentioned, we funded 1,300 innovations, or they funded 1,300 innovations to date. But there's a real barrier in scaling. You can create a pipeline on the supply side of innovations, but you really need to tap into the demand of countries and their primary healthcare platforms, as has been mentioned, to scale systematically. And that's why flipping the switch from supply to demand is so critical. And that's why the comments of the two ministers are so fundamentally important. Now, to do that, this is my third point, the multilateral system can really help. I mean, look at what you've done, Pradeep. And similarly, at WHO, we're working very much on this same strategy with the platform of 152 country offices. That is the mechanism, or a mechanism, to help systematically tap into demand, deepen the innovations in a country, and help them spread from country to country. And we don't need to do that separately in the multilateral system because, as you mentioned, through the SDG 3 Global Action Plan, which is 13 multilateral agencies working together, there's an innovation accelerator where the 13 agencies are working together, including UNAIDS and WHO, are working together to help scale and promote innovation, studying best practices, learning from each other, and working together to engage countries and to connect them with the wonderful people on this call, be they innovators, be they the sources of finance and funders or other entities. So thank you, Pradeep. In summary, this is about getting to the SDGs. This is about solving the barrier to scale together by tapping into what countries need and what governments need. And this is about how the multilateral system can actually help us accelerate back to the SDGs, because for goodness sake, we are going to need acceleration to close the gaps in the SDGs and in universal health coverage coming out of COVID, where we're further behind than ever. So thank you, Pradeep, and thank you, ministers, and to all the partners here, and back to you. And it's an honor for me to be with you.
Thank you, Peter, it's a pleasure to see you again, and thanks for all the work, innovative work at WHO. I think, as you mentioned, we do need these multilateral platforms, and I think the innovative funding mechanisms that both you and Pradeep have brought about is necessary, because we need not only grant funding, but some of that catalytic and also first loss funding that's needed to develop the funding. And to the minister's point, you know, some of it is the innovations that are needed to take this off, but it takes creativity. And one of the things we found is there are very few funders that are willing to explore those territories. I know you know Gerhard Priestwell from Sorona Asset Management, who has also worked with Pradeep on the early days of the platform. And it takes a special type of investor to work with both public and private sector, because there's a lot of push and pull as we go forward in this journey together. But there are wonderful results that have been launched because of it, and a lot of the impact that's been generated. So hopefully the ministers will work with some of these investors so that we can create those long-term solutions to that blended type of capital that's needed, both grant and private investment capital, to deploy these solutions. And to that end, I'd like to bring in Donna Parr, Managing Partner of Cross-Border Impact Ventures, to discuss some of those new models and share how, you know, some funds can respond to the needs specifically of women's health now that gender has become a priority with the new announcement of the G7 and all the investments that are going into gender lens investing.
So thank you for having me here. We're very excited by gender lens investing. We're focusing on this because we see this as a relatively untapped market. There's obviously a huge unmet health need that we've been discussing today, and it goes well beyond what the pandemic has highlighted. We're worried about climate change and the issues that will lead there. But for us as funders in this area, we also see this as a large market opportunity. Over 51% of the women often don't have products that have been designed for their needs. And so we see that there's a real need and a real opportunity to bring product to market. And women also are often doing the buying for their family, both in the food, but more also in health needs. And so targeting products that really meet the needs of women and their family is a large market opportunity that we see that down the road, there will be companies that will want to buy these companies as well. And so we have to look at ways that we can bring companies that can expand, but also have sustainability, that parties will buy our investee companies and continue to operate them. So we're very excited about the opportunity to look at some of the new technologies that can actually reach out and serve a lot of women because of where we are with cheaper advances with digital health. We've seen a lot of growth in telemedicine, real-time diagnostics, so that you don't have to come back 8 days later or 10 days later to get your test results. You can get them 30 minutes later, and then you can get into treatment. And precision healthcare that can really look at what an individual needs and tailor the treatments. And these can be done a lot cheaper than they used to be. And to give an idea of how we look at the world, we take a gender lens approach right from the top of a company as well as the market. So we are looking specifically at, does the technology, is it geared to women? And this goes beyond maternal and reproductive health. We're looking at chronic disease, cardiovascular disease. Women present differently than men, and yet most of the treatments have been designed for men, and women often pay the price because they're not getting access to the proper treatment. So we're looking for technologies that will help women who are disproportionately affected, or treatments that are more tailored to women. We look at the clinical research. Women aren't included. So a lot of the product design that was done before, women were not included in the clinical research. And so now we're looking for ways to involve research to make sure that it's evolved to the point that at least the proportional amount of women are represented, but women all over the world, not just in high income markets, but we need to make sure they're tailored for women globally. We look at management teams. We would like to bring more women in as founders, CEOs, but also throughout the organization. And this will also help with companies to expand women in the workforce and make sure that the economic benefits are reached. We look at boards and make sure more women are represented on these boards. And we look at the overall company culture and development of workforce. So we take a very holistic approach to looking at women and a gender lens in terms of our investments. And we see that there's huge opportunity to better design healthcare to meet the needs of women globally.
Donna, thank you very much. Donna, again, was on her way to Geneva. Sorry you didn't make it to Geneva, but got stuck midway. But really pleasure that you could join us online. I'm going to go back. Minister Demby is back. I'm going to ask Minister Demby. He was posing a very interesting question about the specific challenges. And I would like to invite the other investors in the room and the innovators to respond to some of the challenges. Minister Demby, over to you.
Well, thank you very much. Sorry, we got power out here in Freetown for a few minutes. Apologies there. But I think what I was getting at is, we have a serious situation, a problem that I'm trying to solve here. And we're having a very strong biomedical response. Just looking at the healthcare delivery in this country through life stages, starting from pregnant women to healthy babies that are born, how do they thrive, leading to school health, leading to young adults and adults and senior citizens. But I'm focusing on the first two stages, which is really starting with pregnant women and their babies. And the important thing is with Sierra Leone having one of the highest maternal mortalities in the world, how do we dramatically reduce it from 770 to less than 200 in the next 2 or 3 years? And I'm going to try to deploy as much of the biomedical interventions as we possibly can, having a greater community engagement around it, having obstetric care around it, having all of the biomedical interventions that we could possibly conceive. But one major piece that I think will be a game changer for us is having a digital mapping and a digital tracking of every individual pregnancy in the country. And how do we work with them and have an app of some sort that they will use to register with the nearest available clinic for them? How do they have a case manager at that hospital or that clinic that will work with them throughout the pregnancy? And having a tracking on a daily basis on where mortality is occurring, why that mortality is occurring, and smartly deploy assets and whatever we can to be able to course correct and change what's happening at a district level, at a village level, at a community level. I want to be able to see that on a spreadsheet or on a map of some sort on an app in my office on a regular basis and smartly deploy the response. I'm looking for a digital solution for it. I'm looking for innovators to help me think through this, because I think if we tackle the maternal mortality issues, there are greater applications of the same technology to other aspects, including infectious diseases, including chronic diseases as well. So I throw that out as a challenge for Sierra Leone, but has greater implications outside of Sierra Leone as well. Over.
Thank you, Minister Demby. I do think your earlier point also about having some of these innovations available and mapped. We have done some similar work to the solution that you're looking at, and we'll certainly come back to you and see how we can specifically support Sierra Leone in developing and rolling out such an app that you've requested. We have some of the technology partners also in the room who will be very, very happy to support something like this. Unless Dr. So I'm going to, you will also hear from the innovators shortly. Unless Dr. Leah, if you want to come in, I know that you also have used digital technologies for tracking pregnant women and engaging with them, but if you would like to join in, please do. Otherwise, we can go to someone else, or if you have any other question.
I think it's good to proceed because of time. I just want to add one point on innovation in terms of the COVID vaccine rollout. as a question maybe for innovators and investors, particularly in enhancing uptake or mitigating hesitancy that we're seeing around the world about vaccine uptake. So are there any solutions, innovations that we are thinking of in terms of both digital technology as well as other innovations? Thank you.
That's a great question, and maybe that's an area where we are working with someone. We can certainly connect on that. My guess is that's where we need to also start thinking about not just technology, but also social innovations. And that's an area that we would love to connect with you and carry forward. And if any of the innovators in the room and others, if you have an answer to that, to both the questions, please do feel free to join in. I'm going to turn to looking at the pandemic response. Andrew, I'm going to turn to you. You've been a man with a vision. You even before COVID was a crisis as we know it today, you had started talking about the need for preparing, being ready for pandemics, looking at global health security. I would love to hear a little bit more about the Global Health Security Fund and why now, what inspires you, and also, Bill, thank you very much for being here as part of the GHSF. Look forward to hearing from both of you.
Thank you very much for the invitation. I definitely would like to thank the HIEX team, Pradeep, Biju, Alina, and the entire team for the invitation to join, and thank you for the ministers who joined us today. And really the exciting thing is when I look around the room, I see a lot of partners that some people I haven't ever met in person before, some people I haven't seen since 2018 or 2012, and so it's a real delight to kind of see everyone. This is a community. And I think it's a growing community, and it's important that events like this happen. I also know, I see right now 69 participants online, and I think quite a few of those are people that we've worked with over the years with Pandemic Tech, and now looking forward to the Ghs Fund itself. So my background is a little bit different. I was an emergency medicine physician before in a previous career, and I've been in the venture capital space in digital health, telemedicine, and software for the last 10 years. In around 2016, the co-founder, partner, Lisa McDonald, and I started a program called Pandemic Tech, where really we were looking at a fundamental question, is how do we bring the technology community and the global health security community together? And really what we were trying to solve is, why aren't more people investing in global health security? Taking a step back very quickly, global health security, we're looking at that as a much broader term. People think about that as responding, preventing, predicting, detecting pandemics. But there's a lot more that goes into global health security. For example, mental health is a big component, community resiliency. So we use this as a much broader term to look at the impacts of pandemics and how we're approaching them in the future. And so in 2016, when we started Pandemic Tech, we focused on the fundamental principle that local innovators are best situated to solve local challenges in their own communities. So how do we support their growth? How do we build innovation ecosystems that are critical to scaling technologies, a term that we've heard several times? And then ultimately, how do we get investors, non-traditional and traditional funders, to essentially put money into these programs, provide the capital that these innovators, entrepreneurs, and startups need to grow? And so we had some wonderful initiatives and partnerships, working with the World Health Organization's Africa Regional Office on their Innovation Challenge. I know that Wipro has a very exciting Innovation Challenge underway now. A lot of this was recognized, this problem was recognized in 2016, 2018, and then yet, here still we sit after 2 years of COVID, after understanding this problem for a very long time, and we're still faced with the fundamental question is, why aren't more people investing funds, investing capital into health security startups, particularly in less developed countries? And so with the Ghs Fund, the Global Health Security Fund, we're deciding to do something about it. And so it's really my pleasure to announce, with many of the partners who are here in the room, the formation of the Ghs Fund. It's a new nonprofit association located here in Geneva that's going to be really focused on de-risking investments in global health security and lowering the barriers for people who are traditional and non-traditional investors, like venture capitalists who have typically looked, at returns-based investment. How do we get people to put their money more into these startups? And how do we really encourage these local solutions to local challenges and encourage their growth and their scaling? And so before I conclude here, I do want to thank Mr. Bill Wood, who's come with us from Austin and is the seed funder, has provided the seed funding, and he's part of our team, a partner and a very close friend. I'd also like to announce support from our first two Global Health Security Fund ambassadors, Laura and John Arnold of Houston, Texas, the co-founders of Arnold Ventures. And so it's really a pleasure to be here, and thank you. And I'm really looking forward to working with the whole team on this.
Fabulous. Andrew, really, you can count us also as one of the ambassadors for the fund, because we really believe that this is timely. This is exactly what is needed now. And let me also take the opportunity to congratulate the ambassadors that you've nominated. And welcome to Geneva. This is an ecosystem where global health is influenced, and I'm sure that there are several people in this room who are playing a part and would love to have a conversation with you on. Let me move to someone who, if there is anyone who has been able to summarize what global health innovations look like in 3 minutes, for those of you who have ever been to Slush, which is a conference that happens, it's an innovation conference that happens in Finland. You have disco lights in the room and it's pretty difficult to see anything, but the one who brought all the light was Joe Stringer. Joe Stringer was the head of Google Health and knows innovation inside out. He's set up the 10x Octopus Fund. Joe, once again, thank you for this absolute insight into what drives innovation. Tell us a little bit more about the 10x Fund and what your vision is.
Thank you, Pradeep. And yeah, that was certainly a strange first place to meet. And Andrew, congratulations. That's fantastic news. We need a lot more funds in the ecosystem. So congrats. So as Pradeep said, I, along with my fellow fund partner, Dr. Pooja Sikka, we run the Octopus 10x Health Fund. And we start from a fundamental principle of Europe offers some of the best opportunities in really high growth health technology businesses to scale both south and east to improve over 1 billion lives, which is our overall mission. Octopus as a whole has just under 2 billion under management in early stage technology investments. We make an investment once every week, and at least one of those every month is in health technology, which we hope will scale south and east. Very frankly, we see the rush, the desire of founders to scale into the US as part failure. We see the opportunity for some of these businesses to have a really meaningful impact in the countries where there is larger unmet need as a challenge that we are really excited by. And I think to David's point and also to Peter's point earlier, we couldn't agree more. You've got to start with the problem statement. We see too many businesses which are hammers looking for nails. And when Pradeep spoke to me around, what is our view on pandemic preparedness, our biggest driver and investment thesis is making healthcare scalable. Set aside the immediate short-term response to pandemics. The other emergency, possibly as large, is business as usual healthcare delivery. And the fact that that is fundamentally not scalable at the moment. In particular, 80% of the cost of delivering healthcare is in workforce, in staffing. And we know there is a global shortage around the world. So if there is one critical path to solve, it's making the delivery of healthcare truly scalable. We've seen some short-term strides in telehealth, but I would equate that to the early days of internet banking when people were given cash cards. It's helpful, but it is definitely not sufficient. So what we're excited by now are opportunities to complement telehealth delivery with point of care diagnostics, ideally using the smartphone, with the supporting infrastructure around lab diagnostics and automation to really bring telehealth to life. So it really is a true healthcare experience, not just an initial consultation. Another great example, and I think we're due to hear from her shortly, is Nadine from Proximi. We see them, Nadine, as one of the best examples of really scaling healthcare delivery, where you can have an expert anywhere in the world literally guiding the hand of a surgeon in another part of the world. That is what we mean by really scaling that business as usual healthcare. I mean, it's a privilege to have ministers on the call this evening. And the final point that I was keen to say is, to David's point earlier, I've sat on many sides of the fence as a buyer in healthcare, as an investor, and as a founder. And I think do not underestimate the power of conveying the problem statements. So Minister Denby, we will absolutely work with Pradeep to help you respond to the maternal mortality challenge that you've posed. But the value of that to ecosystems such as this exchange is incredible. So really, please do open the doors and really embrace this community of innovators and investors that want to solve some of these problems. And I think the key aspect of that is we as investors want to make sure that any founders see their role as not owning the journey. It's their point in the pathway and the clinical pathways that need to be innovated as much as the point solutions within those pathways. So it's never been a more exciting time to be in health tech and to be an investor to help really drive some of these businesses. The only final point, Pradeep, is I would not see success as the volume of innovation purely going into local founders. I think we see many businesses that want to scale into the global south, but they just need some handholders to help them do it, and at price points that are affordable. So I think I would rather take a slightly agnostic approach as to where the business is headquartered and focus much more on where the business wants to scale. That for us is true success.
Thank you so much. And I think those are wonderful comments. I think you also need a blend between growing those local businesses and those investments in those local businesses that I know some governments, such as the Japanese International Cooperation Agency and, the Health Innovation Exchange are interested in. Then also that perfect marriage of growing those global businesses locally. So very great point, Joe. And I'd like to turn it over to James Bear, partner and managing director at Biovita Impact Finance.
Cognitive dissonance. I'm from San Francisco, and I'm looking at the Golden Gate Bridge whenever I see you. So, and I know you're not there, but here we are in Geneva. I'm happy to be here and honored by all the expertise in the room. I want to helicopter up and acknowledge Dr. Taldez and Dr. Denby, because they come off as heroes, and they shouldn't have to be. And the reason they are, and I don't know their background, but they're clinically trained, I can tell by the way they talk. And my favorite people and partners in my 30+ years in healthcare have been really smart clinicians who see the bigger picture. And those doctors see the bigger picture. And they've got like logistics smarts and technology smarts and finance smarts that allow them to do the amazing work they're doing. But what it really says is we need to bring that type of expertise into health, and it's happening. And I think the reason I agree with so much that Joe just said, that I heard from Andrew, it's a really exciting time to be in health innovation. And a lot of that is because knowledge capital from these other areas is coming into health. So you now have logistics people, engineers, you now have financiers who care about the field and are getting the field, and they're coming together. So true collaboration, true innovation, and real change, I believe, is possible right now. I want to tell you about Baraka. Am I supposed to just jump into that? Okay. All right. So we are a Geneva-based company. We are approximately 10 people right now spread around the globe. We have built a pipeline of approximately 270 innovators, all with a focus on LMIC solutions. We are spanning the spectrum of health interventions, so everything from digital-based mobile access to AI-supported clinical decision support to patient data management, the entire range. As I said, all of our entrepreneurs are focused on the LMIC, but like Joe, we have many entrepreneurs that are based either in Europe or the United States with Global South solutions. Our company has also put quite a bit of time into a resource that we think will speak to some of the weaknesses that David and others acknowledged earlier, and that is simplifying the investor experience, simplifying investors' understanding. So we have been working with Heidelberg University, Institute for Global Health, and a Swiss data analytics firm to develop a intelligence dashboard that will drive investor decision-making by providing context. So all of those infrastructure, be they health system or non-health system related infrastructure that help to guide decisions and help an investor to really understand the value proposition is something we're spending a lot of energy on right now, and would love to talk with you, Andrew, more about all of that. So we're super enthusiastic. We are actively looking for partners right now. Our co-founders in the room, Audrey Sellian over there, who has been representing a large family office, Rianta Capital, in India for the last 15 years. It was her brainchild, and our other co-founder, Nadeem Al-Dawaj, who's an emergency medicine physician, their vision for a common marketplace in which investors could find these opportunities. And we're up against the same challenges that I know Annie is up against, and Andrew and others have spoken to. In terms of helping investors see these opportunities and have good experiences around making these investments. So
you can hear that concern resonates very much in the room. So you can hear that.
Absolutely.
Well echoed.
Bigger word.
I think it's a good time to actually invite the innovators to talk about some of the solutions that really respond to challenges that we have heard from the ministers. And also where we see that connection happening, the handshake happening between ministries of health, innovators, and investors. So, Joe, you spoke about Nadine and Proximi. It's absolutely, when you see Proximi at work, it's life-changing. So, Nadine, I've always said this to you, it's just amazing to see the inspiration that's driving you to make sure that we have the best quality surgical support in countries, but also preparing, bringing expertise and connecting them virtually. So I don't know if Jeff Ibbotson is here. Jeff, I don't see you, but he might be online. Jeff is the CEO of the Global Surgery Foundation. I also want to recognize Mukul Bola, the CEO of Defeat NCD, who's in the room with us. But let me invite Nadine. I would love to hear from you about how Proximi works and how it solves the challenges that, including Minister Demby, presented. Over to you, Nadine.
Thank you so much, Pradeep. Thank you, Joe, and so many other friends, Annie and Donna, and others on the line. It's a real honor to be here virtually. I'm sorry we had to cancel at the last minute being there in person. But I'd love to share perhaps a bit about my story, which kind of leads into Proximi. My name is Nadine. I'm a surgeon, a reconstructive plastic surgeon, and I spent a big chunk of my childhood in war-torn Lebanon. So I experienced firsthand, even as a child, those challenges around accessibility to healthcare, equity in healthcare, and vulnerability of populations around that limited access. I'd seen it in my own family members, My mother's from the village of Kana, which had gone through some pretty rough times in the mid-90s. So it was something kind of very personal. That's what drove me to be a surgeon. I wanted to try and restore form and function for people. And I wanted to see if, at the very least, with the fragility and vulnerability of life, if I could try and improve their quality of life, then I would have made my impact on this world. And so for about 10 years as a practicing surgeon, largely focused in breast and pelvic cancer reconstruction, I traveled to many parts of the world. Asia, the Middle East, the global South, Latin America, as well as the systems I work with. I'm based in the UK. I work in the NHS at Ghs and St. Thomas's Hospital. And what was very clear to me after 10 years of traveling to many different systems is that largely we have and this was an experience firsthand, that we have a fundamental challenge in surgery, a global challenge, a challenge that we face everywhere, regardless of where you live, around variability in access, variability in knowledge and surgical care, and variability in outcomes. That even till this day, patients are turning up to one hospital having a very different surgical experience than patients turning into another. That, of course, has been compounded with the Lancet Commission and the work that published that 5 billion people lack access to safe surgery. That's 2/3 of the world's population. And it was just so daunting to me as a surgeon, thinking about what impact can I actually make when the problem and the gap is just so big. And at the heart of it, as I started to sort of really grapple with this on a personal level, am I actually making a difference? Can I actually change the world of surgery? It became clear that when we look at operating rooms, these are highly analog and undigitized environments. And we are largely limited by physical co-presence in surgery. And so I started to imagine a world where simply by using a phone or a tablet or a computer, things that are accessible pretty much in most environments, that you could virtually scrub into any operating room around the world, share best practices, and deliver the expertise that is needed close to patients' home and close to their support structures. That imagine that we as a world could crowdsource all the best of surgical expertise and experience and redistribute it to exactly where it's needed. And at a more practical level, I could literally be sitting here at my laptop right now and dial into an operating room in the global South, in the Middle East, in Asia, and anywhere else in the world. And of course, that was a big vision and ambition, but it had so much purpose behind it and firsthand experience. And so we went ahead and decided to build this platform and make sure that everything we did was anchored with evidence and clinical evidence behind it. We are a clinically led team. We're a team of 120 people now, deploying the solution in over 500 hospitals globally in over 60 countries. And we are working in the most sophisticated of teaching hospitals, as well as the most austere of environments, including public sector centers all around the world. And it's been a privilege working with the United Nations Health Innovation Exchange, with Annie and Donna and Shannon Shibata Germanos, who sadly is ill and can't join us today, as well as members of Ariande and Johns Hopkins, working in how can we actually support safe obstetric care in parts of East Africa. And it's been such a privilege to be the enabler, connecting doctors and connecting surgeons to deliver best care to patients, to upskill and support and mentor clinical teams on the ground, and to continue to grow this. So thank you very much. It's an honor to get to share this with all of you, and delighted to offline take questions. I know we're running short on time.
Thanks, Nadine. I'm going to invite Mayur from BlackRock. It's on, you should be okay.
Okay.
How do you get vaccines into a backpack and make sure that it's stable and gets to people where it is needed? Mayur, come over.
Yeah, thank you, Pradeep. Yeah, hello everyone. Here. Yeah, I'm Mayur Shetty, CEO of BlackRock Technologies. We are a healthcare technology company based out of Manipal in southern India. And we've developed some patented technologies to solve some of the pressing challenges associated with last mile delivery of vaccines. I want to share a brief experience with you. About 5 years ago, a healthcare worker, ANM or an ASHA worker in India, came home to immunize my niece with oral polio vaccines, the OPV, and she got the vaccines in a chai thermos flask with ice cubes in them. And when she took the vaccine out, the ice cubes had all melted and there was just water seeping out of it. I got a little discomfort and I said, you know what, I'll pass. And like the minister was earlier telling us about, there's a huge problem with vaccine hesitancy right now, and that's something that we wanted to overcome since then. All across the global south, the standard practice for transporting vaccines is using ice packs or frozen gel packs and insulated carriers. The problem is that more often than not, the temperatures inside these boxes go below 0 degrees Celsius. And including COVID-19 vaccines, most vaccines are freeze sensitive, and ice boxes are notorious in dropping temperatures below 0 degrees Celsius. And in tropical climate, the ice packs end up melting, and we end up administering vaccines that have gone beyond 8 degrees Celsius. So the problem is not just about the economic burden of wasted vaccines, but also the grave risk of administering vaccines that are inefficacious. And WHO estimates that over 50% of vaccines lose their potency before they are administered because of poor temperature control. And that's where we come in. We've developed Emvolio, which is a portable and rugged battery-powered system that can maintain a preset temperature for 12 plus hours in the field. So the device weighs just 5.5 kilograms, can be worn as a backpack or as a sling bag, and it holds the same volume of vaccines that a blue box commissioned from UNICEF is able to carry. We are deploying our solution right now all across India, and our objective right now is to ensure that safe and effective vaccines reach the masses. We are an ISO 13485 certified manufacturer of medical devices with a capacity of over 1,500 units per month that we are scaling up right now. And our objective is to ensure that we reach it's not just about COVID-19 vaccines anymore. Even maternal and child health, which has taken a backseat because of COVID-19 vaccines, because of COVID-19 pandemic, I'm sorry. That's something that we want to overcome. And I want to take this avenue to talk about our product, which is Emvolio. So there's three aspects to this. One is the fact that uniform cooling, all of the vaccines are strictly maintained between 2 and 8 degrees Celsius. So strictly all of the vaccines are conducive until it's administered. Second is rapid stabilization. So another huge problem in the vaccine delivery is freeze-thaw cycles, which is detrimental to biologicals. That's what we're preventing. And the third aspect is an inbuilt IoT system. So it's able to transmit live vital statistics like temperature, location, immunization, coverage, usability patterns to inform value chain decisions. I want to take this avenue to claim that we want to make this system globally accessible and to ensure that every mother and child receives safe, effective, and efficacious vaccines. Thank you. Thank you very much.
Okay, maybe I'll step in. Joanne was going to take over this part, but I'll step in for now.
Oh, sorry, Pradeep. I was temporarily muted, so sorry about that. Go ahead.
Okay, let me now. Thank you very much, Mayur. Let me invite Rtpcr. We have. How do you look at supply chain? So we just saw what Mayur presented, but also how do you deploy drones in delivering, and how do you make sure that these drones can be developed locally? Rtpcr is based out of Switzerland. Let me invite Rtpcr. David is going to join us online. David, over to you.
Hi, thank you very much, Pradeep, and thank you everyone for inviting me. So I'm David Rovida. I'm a CBO of a drone delivery solutions company based in Lausanne. So essentially, we manufacture drone delivery vehicles and software to operate them. The idea that started this company was back 2017, 2016. I was working in Africa with another kind of drones, doing mapping, large territory mapping, and we saw that one of the main problems that needed to be solving was access. And I think everyone in the room has also mentioned that one of the main issues is access. So we got together, the three co-founders. Oriol was working at MSF as a field logistician, and he was already working with drone delivery there back 2014. So he was doing the first deliveries in Papua New Guinea. And we started discussing on, okay, can drones make a change here? Then we've seen that companies like Zipline, they're augmenting this capacity, and they're actually proving the impact of drones in the delivery space. But what we wanted to do exactly is to go directly to the source, not to be able to not to need to actually create a huge infrastructure to do deliveries, but to have a vehicle that you can transport and you can localize wherever is needed to do the routes that are that you actually need to perform. Our idea in drone space, we build the first steps on the technology, the software, and then we will slowly transfer all these skills locally. I don't think it makes any sense to operate drones internationally. I think it makes sense directly to train local operators of drones, local pilots, if you want to call them, of drones. And also at some point, it makes sense to have drones that are locally manufactured. This is why we started manufacturing our drones in 3D printing. So we're able to scale rapidly the production of the drones, and we can actually localize the production of these drones. So doing this, the main component the main technological component of our drones is essentially that they're called VTOLs. So it's vertical takeoff and landing drones. That means that everyone right now that thinks of drones, they see this small 4-motor small drone that can take pictures, that can do a certain range of maximum 2-3 kilometers and then back. What we developed, and considering the needs of global South countries, it's a drone that can actually cover multiple kilometers. It can go up to 120 kilometers to deliver something when needed. So distances are higher. So the drone actually takes off vertically, transfers into an airplane, starts, goes through the airspace, and then lands safely at the destination. It's a point-to-point delivery. Easy to control, easy to actually operate by anyone without having to have a massive training. And essentially, we're working hard in the safety of this. I think one of the main purpose that we had and one of the values that we had here is that we never compromise the safety. So all our drones have a parachute inside. All our drones are fully redundant and are up to the standards provided by FAA and EASA in Europe. And this is what we think we need to implement in Africa as well. It's not the playground where no one cares about the regulations. We want to have the safest drones. And by actually creating these drones in 3D printing and creating these drones with that local operation in mind, we can actually create them to a price that is affordable to be implemented in those countries. So thank you very much. And I'm happy to respond to any questions that you had on the subject.
Thanks so much. What amazing technology, especially now the extension of the healthcare worker using some of the cold chain possibilities that you can do with the drone technology. So I'm sure a lot of the investors are looking forward to hearing more from you. Next, we'd like to move forward to mobile diagnostics. Looking forward to hearing a lot about the mobile lab.
Hello. If you can hear me, good evening from the United Kingdom. We'll talk a few minutes about MolBio and its offerings. MolBio now offers a global first platform that can perform molecular diagnostics for infectious diseases at the point of care. If you look at the construction of the MolBio platform for Rtpcr, you will see that it essentially contains two different parts. One is the true prep, which is the sample extraction device for the nucleic acids, and then the downstream Rtpcr. The systems are usually, the downstream Rtpcrs usually are the Uno, Duo, and the Quattro, depending upon the workload situations. Uno can do about 8 to 10 tests per 8-hour shift in a hospital laboratory. The Duo can do about 20 to 24, and the Quattro for relatively higher workloads of about 40 to 48 tests. This platform is a WHO endorsed platform for Mycobacterium tuberculosis, which is definitely very well known. It's an easy to use system, which can be used by various strata of laboratories, including primary healthcare, centers and real point of impact areas. The system per se is battery backed up for 8 hours, so it can be an ideal platform for running in the field. You would also know that there are about 25 different assays now available, including assays like HIV, HPV, HCV, COVID-19, obviously with the pandemic now, plus a host of other bacterial and viral markers on the system. I can take some questions on this if anybody has. That'll be it. Thank you.
Mani, thank you very much. And we will be, those of you who are online, please do post the questions online, and then maybe we will try and come back to you with questions from the room. I'm going to look at 2 more innovations, and then we are going to move to an interactive map. I'm going to invite Omar. How do you make public spaces safe, particularly when it comes to COVID and beyond COVID, the entire antimicrobial resistance work? Omar, Mauro, and Chiara are here. Omar is going to tell us more about Biovita.
Good evening, ladies and gentlemen. My name is Omar Al-Fatah, and I'm the CTO of PMP Group. We are a group of companies which develop technologies for infection prevention and control, tailored for the low-middle income countries. Our innovation is Biovita, which is essentially an LED lighting technology.
Push you in. Sorry.
No worries. It's okay. Biovita is an LED lighting technology which can kill all types of bacteria, fungi, mold, spores, and also viruses without emitting any UV light, allowing for continuous and safe exposure to humans or animals, and of course doesn't damage any surfaces as in the case of UV. We started Biovita well before the pandemic for an issue probably bigger than the COVID pandemic, which is the issue of antimicrobial resistance. And the concept of Biovita is to sanitize environments without sterilizing them. The goal is not to kill all the bacteria and all the viruses. We need viruses and bacteria to stimulate the natural resilience of our immune systems. So by reducing the pathogens below their infectious dose, we are able to interact with them and train the natural resilience of our immune system and develop the natural immunity. So if you remember, Italy, of course, was one of the first countries outside of China to be hit by the pandemic. And we were lucky enough to start a project with the Italian military to test Biovita on the coronavirus. Up until this point, we never tested on viruses. We were predominantly concerned with superbugs and superbacteria. So we sent them the light and they did an independent test, and we were very surprised that we killed the coronavirus by 99.8%. This test was extended as part of a multi-centric study as part of the European biodefense military network, including the laboratory networks of the German military, the Italian military, and the Swedish military. And just last week, we just had our peer-reviewed publication to confirm the result on the original finding of 99.8% on the coronavirus. So we believe that this can be really a great tool to mitigate the worst of the pandemic, because whatever the solution is, it needs to be simple enough and scalable enough to reach everyone in the world. And this is simply a light, okay? And it emits white light indistinguishable from a normal LED light, in addition to maintaining the same electrical properties as an LED light. The technology is on the diode level, which allows it to be shaped into any type of lighting form, but also it can be integrated into consumer goods and electronics to introduce the sanitizing effect. Thank you.
Thank you very much, Omar. And we almost thought that we would be able to have Biovita lights here and sanitize it, but I know that there are some more bulbs out there, so I'm going to come and steal some of them. How do you ensure? I think one of the challenges that we have is innovations are great. Innovations make a change, but until you hear the voices of the beneficiaries of the communities from the ground, and until you have real-time information being fed back, our systems will never be able to cope with the change. So I'm going to invite Sabyasachi, who represents Dio Technologies, to talk about the work that they're doing.
Thank you, Pradeep. Hi, I'm Sabyasachi, and I'm very excited to be here among you guys. And just to talk a little bit about our innovations. So we are a Geneva-based organization. We are actually next door, and we are the creators of iMonitor platform, which basically is a enabling environment bringing different stakeholders together, starting from the patient communities, obviously, but also civil society organizations, donors, and most importantly, national programs all together to make the health system more responsive. Now, just to elaborate a little bit with one specific example of the work we are doing with UNAIDS and GNP+, where we are supporting HIV communities at the last mile, where we are providing a number of services to the community members, starting from psychosocial support to providing access to information. We have community forums where they can connect with other peer support group networks and things like that. At the same time, we're also bringing the civil society organization, which is GNP+, and their partners together, who can respond to the community needs in real time. And more importantly, the national program, who can kind of makes more prompt response to some of the community needs. Now, this has been implemented with different use cases, with different partners, be it One Impact for TB communities with Stop TB partnership, or working with different PRs of Global Fund, and especially when Minister Dambe was also talking about the vaccine. So we have also been working with the vaccine programs in different countries where the vaccine side effects, especially in the COVID vaccine side effects, can be monitored directly through the patient engagement. Now, a lot has been talked about community engagement in past, but I think post-COVID era, the whole meaning of community engagement has been changed, where it's not seen as a one small project somewhere in rural India or rural Mozambique, but this has become a mainstream healthcare interventions or healthcare delivery system across the globe. And this is what we have learned, and share the acceptability of these community engagement or interventions has increased significantly post-COVID era. Now, when we talk about scale, especially in post-COVID era, we are talking about a number of things. How do we maximize reach within the communities? So a lot of innovation that we are bringing in terms of making these platforms multi-channel, where people can use this platform in their own preferred channels, be it social media channels or 2G channels like USSD or IVRS channels. How does the community members or the national program can actually own it? So making it, the innovation in terms of making it flexible and the smart configuration setup, which allows the national programs to own this platform. Obviously, this is an open source platform, but more importantly, they can own it, they can make changes on the go. And things like that. And I think what we have also done is we have sort of created a highway for other innovations also to contribute. I was talking to a lot of innovators here who I see can leverage a great amount from this direct connect with the patient at the last mile. And just wanted to end with the thought that we are just scratching the surface, and lot can be done in this space. Again, I'm very, very grateful to be part of this conversation, and thanks to Innovation Exchange Program to be here, and looking forward to this further discussion. Thank you, Pradeep.
Thank you very much, Sabyasachi. What we discovered when we set up some of the early prevention programs and treatment programs, and when we could see real-time information on disruption of services, what these guys have done really transformed the quality of the work and the ownership of the community. So that's been really, really interesting. Joanne, over to you.
Thank you so much, Pradeep. I'd like to introduce Eli David, co-founder and CEO of startup Blink. I'd like to ask you some questions related to the coronavirus resilience innovation map. We've heard from a lot of the innovators and a lot of the investors. So if you could talk to us a little bit about the resilience innovation map.
Everyone, thank you. Great being here. So yeah, it's a special day for us today because we're launching the coronavirus resilience innovation map. Yeah, really happy to have the chance to work with HIEX on this. You can see it, it's already live. It's at coronavirus.startupblink.com. I can actually quickly share my screen to give you a quick intro about what it's all about. So basically, it's a global interactive map, more than 2,400 innovations from all over the world about innovations that are impacting our lives. So basically, anything that has to do with prevention, diagnostics. You can see all the industries on the left side. The change over here is that we added a few other industries as this pandemic is evolving. We're seeing the influence it has on other aspects of life. It can be smart tourism, supply chains, and so on. So the idea is just to get all those innovations in one interactive map. This is the third version that we've done of this. The first one we've done already in April 2020. HIEX was very, very fast, and I have to commend you for deploying this, for helping us deploy this, really working like a startup. And that's something that I really like seeing in public organizations. Yeah, and the scope is extended. There are many, many innovations there. I think it's the most comprehensive resource that exists currently in the world in terms of mapping innovations that have to do with COVID-19. The map has a few sections that you can all browse. Champions, for example, all the companies that made even a bigger impact, like the vaccines and so on, and the treatments. Other than that, an interesting aspect of the map is that we took all the data and also did rankings of startup ecosystems around the world with an algorithm that we use for our own global ranking as well. Really nice to see some cities that are doing absolutely great and innovating so much. In the top 10, I can mention a few surprising cities. Some of them actually generated vaccines like Moscow, Toronto, Barcelona. But the nice thing is to see also representations in the top 50 cities that are ranked. From Africa, we have Nairobi at 28, Lagos at 34, Manila at 50. So those are 60 countries and 161 cities that are being ranked on the innovation that they generate. I don't want to say that it's not necessarily a testament for public policy and the success of public policy, but on our private sector, our startup founders and so on that are really picking up and doing so much to help mitigate the risks and the effects of this pandemic. So, yeah.
Eli, thank you very much. It's been such a pleasure working with you and your team on this map. This is the third version, as you said. It's continuously evolved, and I'm always amazed by the creativity of the team and always pushing for greater focus. So the resilience map is now available. Eli, if you could also share the link with everybody who's online, and we'll be sharing the same here with people here. So you've been part of the launch of this resilience map. So thank you very much for being part of that. Maybe I think Roland at the beginning said we are going to launch 2 new partnerships. It's really a privilege to announce the partnerships. We'll start with the partnership with TCS. So Mahesh, if you could help run that. TCS is, if I get it right, is the world's largest IT services company, and they bring a huge understanding of technology, innovation, and they're helping build this digital garage, the spine, where any challenges that come, we will be able to bring together people from all over the world, experts across sectors. And that's something which we have learned, that most of the health solutions, if you really want to, the challenges, if you want to find solutions, the solutions lie beyond the health sector, and there's need for bringing all these people together. So that's where this platform will be available. It's not just a platform for us, it's a platform that's available to all of us. And we would be sending more information on this. We'll be working with the different people in the health ecosystem in taking this forward. I'm excited by the second partnership which we're going to announce. I'm going to invite Shariha to join us here. And we have Judy, who will be Professor Judy Kuriansky, who will be joining us online. Maybe we'll let Professor Judy speak to briefly about the partnership, and then the two of us will formally announce the partnership.
Wonderful. Oh my goodness, greetings to everyone. This is so exciting. And Pradeep and your team, congratulations. You've really shown us how we in the health innovation field are in the right place at the right time. You might think of it as the silver lining in this very dark cloud of the pandemic. That's the word that the UN Secretary General has used, the silver lining, but as a psychologist and an advocate in health who has advocated for at the UN for the SDGs and universal health coverage, I would certainly say that this is post-traumatic growth. And in fact, it is the perfect time in the context of all that has been presented today for me to show you what Health in Your Hands and the coming together with the Health Innovation Exchange is really about, and our partnership that is so exciting. That in fact, here is my, what is going on? This is my shared screen. And I actually need to make sure that I can share because someone else is sharing. So someone else needs to stop share while I share my screen, if that's okay. So let me just say that it is incredibly important that we come together, all of us, being able to join our forces and show that we are working together in strategic partnerships. We all know that there is this urgent need, the gap that Peter has pointed out before. You see in this large number of people who have the need for healthcare and who are not receiving it, and the innovations that we need to promote that do the A's and the S's, making them accessible and affordable and available, sustainable and scalable is all of that. So we're building health ecosystems all together here. Thank you to Pradeep and his friends and all of you and the team in multi-stakeholder partnerships that are leveraging cross-sector collaborations and market-based solutions for that scaling up. Health in Your Hands is an initiative that is an innovation from the Global Council on Health of the United Arab Emirates SDGs in Action campaign. And it really places health at the nexus of the SDGs, as you see in that diagram right there. And in fact, it takes a hybrid approach, especially in these COVID times, where the innovations that are on the platform and where we are joining with the platform of Pradeep's Health Innovation Exchange have a community outreach that we've heard earlier, where people are going to people, actually knocking at their door, because we need that, as well as the technological innovations. We've heard about drones earlier, many different ways of using computers for trainings of nurses, as we see here, and doctors. This is an innovation that was co-founded by myself as an NGO representative at the United Nations and a professor at Columbia University Teachers College, and Dr. Sharia Khalid Erickson, whom you just saw before, an impact advisor and founder of Mission & Co. And so we have a rich history together with HIYH, as we call it, Health in Your Hands, and Health Innovation Exchange, with Pradeep starting at events at the United Nations General Assembly in achieving SDG and universal health coverage through innovative projects, policy, and financing models that we've talked about here to reach those furthest behind, as we say at the United Nations, events at the World Health Assembly earlier, as this one is. Pradeep doing brilliant presentations on health innovations in many contexts, including for my class at Columbia University Teachers College and at webinars that we've done with the United African Congress on innovative technologies, because we know certainly that many countries in Africa, including Sierra Leone, close to my heart and to many of you, that need these kind of innovations. And Sharia and Pradeep and I are now members of the Global Council on Health. And Sharia is moving also to the Finance Advisory Board to bring together all these ideas that we have talked about with financing models as part of the UAE's SDG and Action Campaign. You see our team there who has developed a plan of action, including our co-chairs, Dr. Pate and Dr. Jacob from WHO. We move ahead with our plan of action, and Pradeep and I and Sharia and others on this panel contributing chapters to a major tome that we are doing on resilient health systems. And so bless you to everyone for all the work that you are doing that is so valuable. Over to you for the formal announcement.
Thank you, Judy. I don't know what is the best way to do a formalized partnership that has been in the works for quite some time. Maybe, I don't know, during COVID times, whether we are allowed to shake hands. But the best partnerships are those that work without necessarily having to say much. So, Shetty, if you want to say a few words, it's been absolutely such a pleasure working with you. And Judy, in taking this, you've been driving a lot of the last mile connectivity for innovations. Thank you so much for what you're doing. Maybe if you want to say a few words, it's on.
Well, thank you, Pradeep, and thank you, Judy, joining us all the way from New York. And of course, always bringing a lot of energy into any room, virtual or not. I actually really, just speaking on the subject of energy, I just really wanted to share my appreciation for the energy that has been brought in this room, thanks to you, Pradeep, and your wonderful team, for bringing all of us together. I really think that we all should give Pradeep a big round of applause. Pradeep and his team, Alina, and I only see Alina here, I don't see the others. Because really, this is one of the things that we do need to bring good energies together. You've got to create a platform where people can come and play and collaborate together. And it's with this same energy and intention, I just wanted to say that we are at Health in Your Hands very excited about this partnership that we're announcing today, witnessed by all of you who are already doing amazing work on the ground in multiple sectors and from using multiple approaches. But, you know, this partnership signifies not just the coming together of two platforms that have the same intentions and the same mission to try and bring health into the hands of those left furthest behind, leveraging technologies and market-based solutions. That's one thing. Yes, we're aligned by that same mission and intention. But I think the other important thing really is that by announcing this partnership, we're really looking for that accountability piece on our part, scaling up our individual work, and of course, most importantly, the work of the respective partners and innovations that make up the two platforms. We are bringing 50 in our portfolio right now on the Health in Your Hands platform, and also the Finance Advisory Board, which Dr. Judy just mentioned, I'm just joining, and some pretty exciting organizations that are part of that. It's going to be announced formally in January. And on the other hand, you're bringing so much, all of this and more. So we're just very humbled to be part of this. Thank you so much for all you've done. And we're very excited to meet the other 50 innovations that are on the Health Innovation Exchange and explore how we can really scale impact in health into the hands of those left furthest behind. And yeah, excited to see what this will do for the ecosystem as well. We mustn't forget it's important to have that ecosystem piece, that intentionality to strengthen that and build resilient health systems. And also just one personal note, it was just so wonderful to hear Dr. Nadine Haram share about what solution she has built. I used to be a plastic and reconstructive surgeon working at Tommy's, Guy's and St. Thomas's Hospital. And I remember in 2001, but this was like a placement in Malaysia, I had to operate with a massive surgical book on the side and try and do a flap. I have no idea what happened to the patient at the end, but imagine 20 years later, you know, the success of Proximie is just astounding. And you know, it's so important that platforms like ours support individuals like that who really want to create change and make the connections on the one hand, but also showcase and share their work so others can also be inspired and step up and do something about it. So thank you for this partnership. On behalf of Judy and I, we're very excited.
Shetty, thank you very much. Just a couple of quick words. One is, I think at this point of time, if we do not stand together to support innovators, because I'm seeing the financial crisis that's coming up and already we are in, if we do not really come together and shore up the investments that have been made and the need for the runway that is needed for several of the innovators to take off and have impact, I think we will lose so much of the progress that we have made. And I think that's where coming together, this is such an important part. And what we have also seen, even in this room, it's fascinating to see when innovators come together, each one holds a different part of the puzzle. And when people come together, when you create that platform, and that's where for me, this partnership with Health in Your Hands is so critical, is that when you start connecting innovations, that's where magic happens. And that is something which we've already seen in terms of the magic that we have seen between the platforms, working with you, working with Judy. And one last thing before I know it's been a long evening, I know, sorry about that, but sometimes, you know, standing here in front of everybody, I certainly feel that sometimes it's really wrong because most of the work is not done by me, it's the team. I really want to call out on the team which has been pulling all this together for weeks and weeks and weeks, who have been working behind the scenes. I really want to appreciate the work of Elena, Veli, who's sitting here, Miriam, who's sitting there, Kirsten, an amazing young woman who's been able to do, Mahesh, who's there, Joyce, who's here, Tasha, who's online, Annie and your team, Donna and others, and Shannon, who's not able to join, but has been amazing. It's just been amazing. And also, you haven't met Biju yet. Biju runs the India Accelerator. It's just been amazing to see the way, he's probably the most connected mentor for innovators. I keep teasing him saying that he's supported so many innovations that have gone on to become unicorns. He's pretty bad like me in business terms. He's never taken a stake in it. Otherwise, he would have been a multi-billionaire. But some of us work for the fun of it. Others make money, but that's a different story. But it's been such a pleasure. But just to thank the team, because it's the team that's been doing the work, but it's been really amazing to have this partnership. Girish, I know that Girish was sending me a message that your session has gone on so long that I've managed to complete my flight and I've also landed. Girish, I don't know if you're online, but if you are, I would love to hear a few words from you. It's been, Girish is probably the huge thinker, and he's the one who, when we spoke to him about the challenges with the health system, you know that about 30% of health commodities in most countries get lost or expire due to expiry of drugs. Girish said we need to create a spine that connects clinics, the pharmacies and the different pipelines that go through. Girish, thank you. It's been such an honor and privilege for having worked with you on this and for your continuous support. You have supported us without any questions and always look for what is the best thing that we can do to reach SDGs. So if you would like to say a few words, Girish.
Pradeep, first of all, thank you. Congratulations to everyone in the room. I'm sorry I'm not in person. I was actually supposed to fly as late as last evening. And then I made the call along with Pradeep that I will instead fly to India. So that's the reason I just landed in India and I couldn't join for the first two parts. But I want to first congratulate Pradeep, you and the entire team for putting this together. We at TCS are extremely committed to see how we are able to bring the best of technology. As I said, there is technology. There used to be technology in every business, but now things have changed in the last 2 years. Every business has become a technology company. Okay, so it is, and since we are at the cusp of leading technologies, we want to see how we can bring this digital spine alive, to see how we are able to connect all the countries, the innovators, the government, the private sector, as well as the research institutes as well. Okay, so I'm really looking forward to this. As I said, we are already building a blockchain solution, and I hope that we are able to bring this in the next. By the time we have the next session, we will show it live to all of you. Thank you, Pradeep.
Thank you. Thank you very much, Girish, and I hope you have a good time. He's in my part of India, so I'm a little jealous, but thank you very much. Let me hand you over to Katya, and before I do that, Joanne, thank you very much for this remote moderating together. It's been a great pleasure.
No, thank
Katya.
you, Pradeep. Thanks a lot, Pradeep, for everything, and the center looks forward to working with the Innovation Exchange.
Thank you so much. Katya is the president of, is the managing director of the Geneva Innovation Movement. She knows more about the Health Innovation Exchange because she's been tracking it along with Professor Tina and Lisa. But thank you very much for being a co-organizer of the event.
Thank you very much, Pradeep. Thank you to the team. Thank you for allowing us and inviting us to co-host this event with you. I know I'm standing between you and your refreshments, so I won't take too much longer of your time. The Geneva Innovation Movement is built on research, academic research. We aim to nurture pathways for innovation between organizations, as well as develop capacity building in organizations to foster more innovation. So what an inspiring event today. Really amazing. 2 hours flew by so quickly. Congratulations to the fund that was launched. Congratulations to the 2 new partnerships, to the interactive map. I think we've been privy to a completely new reality that you've showed us and allowed us to be part of. We also saw a lot of innovations presented today, both from the country ministers as well as here in the room. And one thing that really resounded to me, what was the same about all of these innovations, what do they all share, is that none of them would have happened in isolation. All of these innovations draw their success from this ecosystem that the Health Innovation Exchange has been able to develop as a platform. And this ecosystem, and I just had 4 words that really resonated out of these 2 hours. First one is communication. So this dialogue between the 3 different sectors that we've been able to start here, this is just the beginning. We've opened the doors to this communication, and we can continue it here now. The second is the connections that we're able to make here in this room as we get to meet each other, as we get to interact, meeting the country ministers, meeting the venture funds and the innovators that are going to start changing this world. And finally, the last 2 is local champions and scaling. We have an opportunity now to use our collective brain power here, use our collective experience to interact with these innovations, to really help them scale, give them advice, give them feedback, and help them turn into real local champions that we can support and that can show the work of the Health Innovation Exchange and our shared ecosystem here. So I would invite you all to give your feedback in the back of the room. You can interact with these innovations, write on Post-its, provide your contact details, and really support them in each individual personal way that you can. So thank you very much, Pradeep, and thank you to the team and everyone who is here today.
Thank you very much, Katya. I'm going to invite Bill, if you would like to say a few words. I also think Anand is sitting there, who is going to be introducing the innovations and helping you. Anand has been the political engagement leader. He's the person who brings political leadership together, and he's been playing an amazing role bringing political leadership into the conversation in several parts of the world. So thank you. But Bill, thank you very much for being here.
Thank you very much, and I'll keep this brief. Yeah, my name's Bill Wood, and I've been working with Andrew to launch the Global Health Security Fund. We're very excited about this, and we think Geneva is the best place in the world to launch this, and this is where it will be based. I provided the seed funding. I'm a venture capitalist. I've been a venture capitalist for 37 years. I kind of bring a venture mindset to this process, and there are a couple of themes that resonated with me today, which I think represent that mindset. And you know, first of all, it's like innovation is great, the technology is great, but it's not the total solution. And in the venture mindset, we spend a lot of time on product market validation, making sure that there's fit between the product and the market. The market is significant. It's targeted in the correct way. We spend a lot of time thinking about scalability. In validating scalability. We spend a lot of time about thinking about what's the right go-to-market strategy. So I think we're looking forward to bringing that discipline to this process and helping these innovations achieve a higher rate of success by applying that mindset to the process. And we're very excited to be here, and we really appreciate the opportunity to announce the fund today with you.
Congratulations again, Bill. So with that, let me take the opportunity to invite you to go meet with the innovators. For those of you online, if you have any specific questions for the innovators, we'll also be sending you a short deck on each of the innovators so that you have a good understanding of where each of the innovators are working, what solutions they are responding, what challenges they are responding to. So let me thank those of you who are online. Thank you so much for staying with us and for taking the time to be with us. My special thanks to the ministers and to everyone who's been part of the panel and who's been listening. Thank you so very much. It's such an honor. Roland and Jean-Francois and other board members, thank you very much for your continued support. So please do come and engage with the innovators. They are here. They're going to be, you can actually see each of the innovations and speak to them. And then we'll also have some, do I call it refreshments served in the room? So we'll have people coming in with refreshments. So stay in, we'll make sure that you have, you're well nourished. Thanks again to the Global GHSF for supporting the reception. I also want to thank Alex, who is here, who's been a photographer, who's been amazing. So we'll get you pictures of the session also, and the video link will be available. Thank you. Thank you for your patience. Thank you for being here. And don't think of this as a goodbye. We really look forward to continuing these conversations. Each of you has been invited. We are just roping you in into a longer conversation. Thank you very much. Have a wonderful evening.